This slide is on the process of ossification. And ossification is the formation and the development of bone connective tissue. And it's a process that begins during embryonic and fetal development. There's two main patterns of ossification. There's one type called intramembranous ossification, which is responsible for producing flat bones of the skull, some facial bones, like, for example, the zygomatic bone, the vomer, the maxilla, mandible, and the central portion of the clavicle. Pretty much all of the other bones would be endochondral ossification. And endochondral ossification, notice the root of this word looks like chondrocyte, which we know now means cartilage. So it begins with a hyaline cartilage model, and it's responsible for producing most of the rest of the bones in the body, such as the upper and lower limb bones. So the long bone is a really good example of endochondral ossification. Now, when we think of different types of bone fractures, there are a lot of them, and this gives you a list of several different types. Some of the more common ones are the comminuted fractures, where it looks like the bone has actually been splintered into several small pieces between the main parts. There could be a complete fracture, a generalized fracture, where the bone is completely broken into two or more pieces, as well as a compound fracture. The broken bone ends actually protrude through the skin. A depressed fracture could be one that could be found in the skull, where it produces a bone concavity. A green stick fracture is a very unique one, where if you kind of think of a young tree limb where it's not yet completely mature, if you try to break it, it doesn't completely break. So one side of the bone breaks and the other side is bent. So it occurs typically in children before the bone has not completely formed. A hairline fracture is a common one, where there is a fine crack in which the sections of the bone remain aligned. So it's common in places like the skull. A stress fracture would be thin fractures that are repeated due to stressful impact, such as running. Can be very difficult to see in things like x-rays. Bone scans may be necessary to actually see them. A transverse section, as you could probably imagine, is a fracture at right angles to the long axis of the bone, similar to a transverse plane that you learned about early on in the semester. An oblique one would be a diagonal fracture that is at an angle to the bone. So we're seeing various examples shown outside of this table on the slide. The last part of this chapter is bone markings. And bone markings are very important surface features that you will see as you are examining bones. So the next couple chapters will actually be on learning specific bone markings on bones. So after this chapter, you want to master the main bones that are in the skeleton. There's 206 bones, but remember that a lot of them are right and left. So, for example, we have a right humerus, a left humerus. We have multiple phalanges, which don't have specific names. So it's really not as bad as it actually sounds. So some of the bone markings that I want to point out to you here come into groups. For example, their main purpose. So if the purpose is that it's for an articulating surface, we have four different ones. We have a condyle, a facet, a head, and a trochlea. It's important that you kind of know what these words mean, because it'll make your life easier when you're identifying some of them on bones. So bone markings serve for sites of articulation, openings or passages for vessels and nerves, and also attachment sites for tendons or ligaments. So a condyle is a large, smooth, rounded oval surface. Epicondyles are on top of condyles, which we'll see on our next slide. A facet is usually a flat surface. A head is a rounded epiphysis, which you now know is at the end of a long bone. A trochlea is a smooth pulley-like process. And specifically, there's going to be an important one that you're going to be learning about, which is in the elbow region. The next group of bone markings are depressions, one of which is an alveolus, a deep pit, or a socket. These are found in the maxilla and mandible as sockets for the teeth. Fossa, plural would be fossae, and they are flattened or shallow depressions. And a sulcus is a narrow groove. The rest of the bone markings are projections for tendons or ligaments and openings and spaces. For a crest, it's a prominent ridge-like projection. There's going to be an important one that you will learn in the hip region called the ilium. A projection on top of a condyle would be an epicondyle. A lot of times these are found in places like the knee and the elbow joint. A line is a low ridge. A process is any marked bony prominence with the purpose of being an attachment for a tendon or a ligament. A ramus is an angular extension of a bone. A spine is a pointed, slender process. There's a trochanter, a tubercle, and a tuberosity, all of which have slightly different definitions. The big trochanter would be found only on the forum, and it's called the greater trochanter and the lesser trochanter. There's tubercles, which are small, round projections, specifically found on the humerus. Tuberosities are very important because they are attachments for muscles, one example of which would be on the tibia. Openings or spaces are things like canals, fissures, foramen, a meatus, and a sinus. Fissures and foramen are really important because they are holes for nerves, like the spinal cord is a really big one. It's called the foramen magnum, and it's an opening for the vertebral column, the spinal cord. So examples of some of these markings that we'll be encountering shown on the pelvis here, you can see is a facet, a crest, this is called the iliac crest, a fossa, a spine. There's a couple different spines that you'll be learning about in a couple of chapters. A foramen, this foramen is what's called the obturator foramen. And when you get to the appendicular skeleton, you'll be learning the names of some of these specific ones. On the femur, we have, in this example, called the greater trochanter. This arrow that I'm pointing to is the lesser trochanter. The epicondyles and condyles are going to be in the elbow and the knee region, which is where this would be located. And then finally, the skull has things like fissures, the ramus, foramen. This is what's called the infraorbital foramen, just because it is located inferior to the orbital socket. And there's some other examples shown on the humerus. For example, tubercles. This example of the tubercle would be called the greater tubercle.